Hello and welcome. My name is Dr. Jaysson Brooks. I am a pediatric orthopedic surgeon at Rite for children. And if you're viewing this video, that means we've already met, or you've met one of my colleagues and they've decided, or I've decided that your child needs surgery to correct their scoliosis. And I know probably after you heard this recommendation, there are all sorts of questions swirling through your mind. So my hope is that this video can kind of answer any questions that you might have, so that when we see each other in person again, we can go through any particular questions that you might have that might be individual to your family or to your child. First off, on the morning of surgery, you will see me again. And on that morning, we will talk and I will answer any further questions that you have. Personally, I'm always praying before every surgery with the hope that everything will go well. I have had families ask me to pray with them before surgery. It's something that I'm more than happy to do, but of course, don't at all feel obligated. Outside of that, I answer any questions that you have, remind you of what the surgery is going to entail, and then your child gets rolled away to the operating room. I have had families ask, is it okay if we can stay with our child until they put them to sleep? For almost every modern hospital now, that is actually not the norm. But you are in the pre-op area until they roll back. And so you'll be able to get all your hugs and kisses in at that time. When they roll your child away, don't be surprised if you see me getting breakfast, because for those first 30 to 40 minutes, they do not need me. The anesthesiologists and the nurses are working to put your child to sleep, to insert any IV lines and make sure that all of the monitoring is hooked up. And when I say monitoring, we use a standard monitoring system to make sure that all of your child's nerves are working normally throughout the case. And so in order to monitor the muscles in the arms and the legs, they have to insert various sensors into the muscles while your child is asleep, of course, so that we know exactly what's happening. So all that takes actually a lot of setup. And so usually I have more than enough time to get pancakes and eggs, and you may see me there, but don't think that that important work is not being done at that time. So after about 35 to 40 minutes, that's when I get the call to come to the operating room. And at that point, we flip your child on their belly and we make a straight incision down the center of their back. Even though your child's spine is curved, we're still able to get to the spine through a straight incision. We carefully dissect down to the bone of the spine. And just for example, this is an example of some of the curves that we deal with. And as you can see, looking from the back, you have your pelvis and the head will be up here. Looking from the side, you can also see that there's quite a bit of a curve in this area also. So we usually use a special bone cutting tool that allows us to loosen up various parts of the spine so that we can move it more easily. And so that bone cutting tool, we basically apply to various areas where we know we're going to need to put in our rods and screws. Once we use a bone cutting tool, usually the spine is much more flexible at that time, and even with our hands, we can move it pretty straight. Once we make those cuts in the spine, then we have these special screws that we basically drill into various parts of the spine. These screws are oftentimes made out of titanium. The back of these screws is actually open, and it allows us to lay rods into the back of these screws. The rods are made out of various metals. I preferentially like to use cobalt chrome, but sometimes we have to use titanium rods also. Regardless of what the metal is, we take the rod and then we bend the rod in the shape that we want your child's spine to basically take. And then we have special towers that we attach over the rod and on top of the screw. And those towers basically bring the spine up towards the rods. And that's how we get your child's spine straighter. You may be able to see that there are little caps in these various screw heads. That's what we put at the end to lock the rod into the screws. Once we're done with this part, then we basically use another special tool that basically makes all of these bony surfaces bleed. And the bleeding is important because we want your child's spine to fuse. The whole purpose of fusing means that this area is not going to move anymore. And all those little areas that we make bleed, the body actually tries to form bone because it thinks that it's healing fractures. And as it forms bone on top of these areas, that's the fusion process. But that fusion process occurs months after the surgery, which is exactly why we don't want your child doing too many strenuous exercises or activities after the surgery, because the fusion process is actually still taking place after the surgery is done. Normally, my surgery days are on a Tuesday, and for most of my patients, if we finish their surgery by 1 p.m. on a Tuesday, they're usually up and walking by that afternoon. If they're too tired to walk that afternoon, we have them up for sure walking the next morning. And a big milestone for the day after surgery is getting up out of your chair and walking around your room. Some patients actually feel pretty good the first day, so they actually get out of their bed and walk outside of their room and walk laps around the hospital unit. If you can walk laps around the hospital unit, that's a good sign that you're going to be ready to go home. And most of our patients, I would say more than 98% of our patients do go home 2 days after surgery. So if you had your surgery on a Tuesday, most times you're home by Thursday afternoon. 99% of the time, we use sutures that are all dissolvable. So nothing needs to be cut out from a suture standpoint in your child's incision. You don't need a brace after surgery. You don't need any special wrappings around your back. Most patients say that their worst complaint is soreness and kind of muscle cramps. And that's because for the majority of the time that you've had this curve in your spine, the muscles that wrap around your spine, they're also curved. But when we make your spine straighter, those muscles get stretched out, and the body doesn't really like that. But we do give you lots of medication to keep you comfortable, to help with the muscle spasms, but usually the muscle soreness is the main complaint from a lot of our patients. The reason why I love doing surgery on kids is that they're healthy and they bounce back really, really quick. And so unlike some of the people that you may know who are adults who've had spine surgery, most of our patients are off of all their pain meds 2 weeks after surgery. If we did the surgery during the school year, most of our patients are only out of school for 1 month. And if you played a contact sport like basketball, football, soccer, volleyball, we would likely let you not return to playing that contact sport until 6 months after surgery. However, when it comes to conditioning your body for the sport, a lot of our patients can do that even during month 2 and 3 with regards to jogging and weightlifting and things like that. So again, when your child returns to school is very much up to your individual surgeon, but I will say there are a lot of our patients who after posterior spinal fusion are feeling great and go back to school 1 month later. There are some patients, even some patients of mine who said, like, hey, I'm ready to go back at 3 weeks, and I'm trying to hold them back and just say, hey, take it easy, But usually 3 to 4 weeks is about that time frame. But some patients need extra time, and they might have to go back at 6 weeks. And so it's an individual decision between you and your surgeon, but usually after a month, most kids are back to school. How your scar looks is very much dependent on how your child heals. And so you can look at their knees, look at other areas that they've scraped, and if your child, whenever they get cut, they heal with a really thick scar, that's an indicator of how their body reacts to any sort of cut. And so even if we close your child's scar perfectly straight, sometimes if they heal with what we call a thick scar, they're gonna form a thick scar back there. I would say that's a very small set of kids that form keloids or things like that. The majority of kids, when we close them with a nice, perfectly straight scar, that's what their scar looks like. It's a very thin line that's kind of hidden in the middle of their back. And so the scar is actually very difficult to see in most kids. So that's kind of how the process would normally go. But it's important to understand the things that could go wrong. The worst thing that I think I could ever do is paralyze your child. I can say to date, I have never done that. but I will never be that cocky surgeon to say that it could never happen. If you look at all of the surgeries done on kids' spines across the country, the risk of paralysis is exceedingly low. It's less than 1%. It's almost so low as 0%, but it's not 0%. So that risk is there. The only way to get the risk down to 0% is to just not do the surgery. But understand that it is very, very unlikely when it comes to this surgery. We have an amazing team of neuromonitoring specialists who are going to basically be monitoring your child's spine the entire time. Other things that can happen is infection. Whenever you put hardware inside someone's body, whether it be in the spine or the hip or the foot, bacteria can latch on to that hardware and cause an infection. Again, the best part about operating on kids is that they don't have a lot of the other medical issues that increase the risk of infection, like being smokers or having diabetes. With most kids, the risk of infection is extremely low, less than 5%. In some studies, the risk of infection is closer to 1%, but the studies show that the majority of patients do not get infections after this surgery. Another potential risk factor is pain. There are some patients who it just seems like their body just does not like the hardware, or maybe they feel a little bit of pain and soreness when the weather changes. The majority of patients do not experience this, but there is a smaller subset of patients that do. There's no way to predict before surgery which patients may experience kind of continuing pain after the surgery. But for the most part, if your child had back pain before the surgery, usually after the surgery, the pain is decreased. But there is a smaller subset of patients where their pain just persists at a low level, but still persists after surgery. There is a risk of your child needing to have a blood transfusion after the surgery, because every time we have to make a hole in the bone to insert a screw, blood usually comes out of that hole until we put a screw into it. Despite the fact that we do tend to put in a lot of screws, the majority of our patients never need a blood transfusion. Whatever your child loses, we suck up with a special machine called a cell saver, and we put it in a bag and we give it right back to your child. So it's their own blood. But sometimes that's not enough, and we actually might need to use donated blood in order to make sure that your child's surgery is safe. So that is one of the things we would get your permission for before surgery. Some families have asked, well, what is the general risk of my child ever needing to have another spine surgery after the spinal fusion? I will say in the past, we thought the answer was never. There has been some recent data to show that if you look at kids over the course of 10 to 20 years after they've had a spinal fusion, there is a risk of reoperation, although it is still pretty low. Just looking at some data here, the overall risk of your child needing to have an additional spine surgery after a spinal fusion is 5% over their lifetime. That means that 95% of the patients, that spinal surgery is the only one that they ever get. It's important to understand that risk is there, but the majority of kids never have to experience that potential risk of needing additional spine surgeries. I know this is a big decision, and I thank you for trusting Scottish Rite with your child. Fortunately, we do this every day. We have an amazing team of nurses and anesthesiologists and surgical technologists and neuromonitoring specialists, all of whom make sure that your child has the best possible outcome. My hope is that this video has answered many of the questions that you may have, so that when we see each other in person, I can answer any specific questions related to your child that you may want me to answer, and then we can sign the consent form so that we can move forward with your child's surgery. Looking forward to seeing and talking to you, and please also give me some feedback on whether this video was helpful or not when I see you. Take care.